Our next speaker is Kathryn Moseley. One of the most important things, if you ask me, and when I teach my students, I say, you always want to have options. You may not want to try Kuvan, you may not want to try PegPal, you stick to the diet or something else. But the great thing that's happening right now in the whole PKU community is there are multiple options that are now becoming available. You just heard about from my talk and also from Barbara, Kuvan, PegPal, and next speaker, Kathryn's going to talk to us about another option, which is the large neutral amino acids in the treatment of PKU. Kathryn? And I have to ask, what's going on with USC in this football thing?
We're so upset.
I'm a fan.
I know, so is my husband. He's sick about it. Okay, so I have to make sure I know how to do this. Thank you very much to the organizers for allowing me to present this information, and I'm so excited to be a part of this organization. It's just fabulous. So I'm going to talk about large neutral amino acids, maybe. Okay. So my objectives are to present past and current information about it, describe what's happening, and just give you some of our experience and talk about a couple of studies that we've conducted. So the large neutral amino acids, it's not really a new idea. It started as early as 1953, and then in 1976 was the idea that this could be an alternative for treatment for PKU. It wasn't until 1999 with the Pete's article, though, that spiked our interest in the large neutral amino acids. Because what he was able to show is that in PKU, the high phenylalanine concentrations in the brain causes a slowing of the electrical activity in the brain. And by giving large neutral amino acids, it actually blocks the Phe influx from crossing the blood-brain barrier and disturbing that electrical activity. So it piqued our interest, and then again 10 years ago at another maternal PKU meeting, Dr. Gutler from Denmark was there, and we were talking to him about it, and we found out that they had been using the large neutral amino acids in Denmark since 1985. So it was at that time that we were able to go to Denmark. And I talked to several adults and adolescents who were on the large neutral amino acids, and they were healthy, working, happy, normal, and it was really a very interesting time because we had no options 10 years ago. So these are the large neutral amino acids, and these are the amino acids that actually cross the blood-brain barrier. And phenylalanine is the one that gives us all of the problem. So back to what happens in PKU, which you heard earlier from Ray Stevens, is the phenylalanine doesn't break down to tyrosine. But it turns out tyrosine and tryptophan are very important amino acids in PKU because in that pathway, usually in PKU, the phenylalanine is very high, the tyrosine is low, and the tryptophan is very low. And tyrosine and tryptophan are precursors to the neurotransmitters serotonin for the tryptophan and dopamine for the tyrosine. And these can have an effect on your neurocognitive and your movement. So this is what happens when everything, your Phe levels are okay and you're taking your formula, all the large neutral amino acids get on this transporter to the brain. But what happens in PKU, when your Phe level goes high, the only amino acid that gets on this transporter is the phenylalanine. So all of these other amino acids don't get on. Protein isn't synthesized in the brain, and then it causes all kinds of problems. So the large neutral amino acids work on the brain level, not the blood level. So and in Pete's article, despite the high plasma blood Phe, it blocked out the phenylalanine from the brain. This was very exciting for us because we had adolescents and adults who were not following the recommendations and who were having problems of taking the formula. They didn't have the as many formulas that are out there now, and so we decided to bring this over and do a study. So as I said earlier, it started in Denmark in 1985. It's offered at 15 years old, they decided, well, they noticed that their adults and adolescents weren't following the recommendations and weren't during the diet, so they came up with this therapy. And it's not the fee-restricted diet. Actually, it's the opposite of the fee-restricted diet. With the fee-restricted diet, about 80% of your protein comes from the formula or the medical food product, and about 20% of your protein comes from natural foods. The large neutral amino acids is different. 80% of your protein comes from natural food. About 20% of your protein comes from the large neutral amino acids. So that's where it's different. In the United States, we have 4 different products that are available. The Phi Block tablets, NeoPhi, comes in tablets and a powder. The Lanaflex powder, and the Preconil tablets. So this is what's available in the United States right now. So after we went to Denmark and decided we were going to do this, we brought it over and we did a study where we measured the phenylalanine in the brain and the blood, and a 6-month study. And what we found out that the blood-free concentrations basically stayed the same. There was no big difference in the blood Phi. The tyrosine went up, the tryptophan went up, and the brain Phi concentrations went down. So what we also found out is individuals with PKU have a very unusual amino acid pattern. And when we gave the large neutral amino acids to these individuals, it normalized their amino acid pattern. And it also made their ratio between tyrosine and phenylalanine much smaller. We had one patient come in who had a ratio of phenylalanine to tyrosine of 69. And after he started the large neutral amino acids, his ratio went down to 6. And they all did very well, and they all felt very well, and they're all still on therapy. So another thing we did is we are trying, Dr. Koch has been very interested in treating all individuals with PKU, even the people that were late diagnosed and untreated. And we had tried many times going to the institution in California to treat individuals who hadn't been untreated, who haven't been treated. And it was very, very difficult because the fee-restricted diet we could not do, because the individuals who worked there thought that the only joy these individuals had was the food, and they didn't want to take away their food, and they had a cook-chill system, and they couldn't cook the low-protein products, and there weren't that many around at that time either. So we decided to go in and see if we could help them with the large neutral amino acids, because there wasn't much change in the diet. They could have regular food. Actually, the recommendations for the protein for the large neutral amino acids is the same for everybody in this room, but everybody eats way too much protein. It's 0.8 grams per kilogram, which my favorite place to go to is Baja Fresh. And I noticed that they had a low carbohydrate meal there that has 72 grams of protein. Well, that's even more than one person should have in one day. But we tend to eat way too much protein. So all we did was just cut back on their protein and give them the recommended amount by the the recommended dietary intake, and then give them the large neutral amino acids. And we had about 200 individuals that we think are untreated in group homes and in the institutions, and we were able to get the information from the state of California where these people were, and it was very difficult enrolling these patients into the study because it's easier to just give them drugs. And how they're treated really is by their behavior. They really don't care if they have PKU or not. In fact, when you go into an institution, everybody gets 100 grams of protein, and you're treated by your behavior. So some of these individuals were on a ton of psychotropic medications. That's how they treated them. And we decided that we had one patient that we had taken out of the institution who was in the institution for 35 years. In fact, there's a video out about her, that's distributed among the clinics. And when we treated her, her Phe level, I think, was 32. We started her with the Phe-restricted diet, and her levels went down to about 10, and she did very well. And she's been on the large neutral amino acid therapy now for about 8 years. We transitioned her over to that, and doing very, very well. So our objectives were to assess the health outcomes, provide the treatment and information, and to get them hooked up basically to a metabolic clinic because they were not treated for their PKU in the institution. So we had 14 late diagnosed individuals enrolled in the study, and only 11 completed. We had 2 individuals that were on psychotropic medications, much more than the other individuals that for some reason, and we don't know why, but we think it had to do with the psychotropic medications, they were losing weight. So we had to take them out of the study. And what we did was we wanted to find out if there had any impact on their behavior. So we took we gave them a Vineland, which is a Vineland, I can't remember exactly what it's called. A Vineland Adaptive Behavior Scales, before and after, thank you, I've got to read my own thing. And we had them also do monthly assessments of their behavior, how many times they hit themselves or banged their head or something like that. So they did that monthly. And what we found out was they did a monthly checklist. We had the Phe tyrosine obtained monthly. There was dietary intervention where we just gave them the large neutrals, and basically they had a regular diet. And what happened was expected. We didn't expect to see a big change in the blood Phe, and we didn't. The tyrosine, though, went up. The phenylalanine tyrosine ratio went down, and their behavior improved. There was, this is what happened in the ratio in the blood Phe, no significant thing, but there was a significant increase in the tyrosine and the ratio. There was a big correlation between the increased tyrosine and their independent improvement in their daily living skills. There was a significant correlation between the tyrosine and less aggression. And it looks like, well, the tyrosine made all the difference in the world, but it's just because those blood Phe levels didn't change, because everything is happening on the brain level. You're not going to see it in the blood. There are some people that are on the large neutral amino acid therapy where their blood Phe, we're able to keep their blood Phe between maybe 12 and 16 in that range, even on the large neutral amino acid therapy. And then the biggest change, of course, was in the daily living skills. We had 1 patient declined, 2 had no change, and 4 improved. But this was a small pilot study. Observed behaviors, no significant improvement, but there was a trend toward reduced self-interest behavior and aggression. So the cost benefit was rather exciting because we used Preconil at that time, which was from Denmark, because there weren't any amino acids, large neutral amino acids available here. And most of these individuals, in fact, all of the individuals that were in the institution were treated with psychotropic drugs. And we had to work very hard with the psychiatrists to please, discontinue the drugs while we implemented the dietary treatment, which was the problem in PKU. And we were able to transition some of these individuals out of the institution into a group home. So this was the cost of the medications before going into the study, and then the cost of the medications after this 1-year study. This was just 1-year study. So there was like a 50% savings. And then the cost-benefit analysis, it costs in California about $236,000 to be housed in the institution. And the average cost of living in a board and care home is $122,000. So there is a savings of taking them out of the institutions. And we have a home just for PKU in California, in Burbank, where we've been able to transition 5 individuals out of the institution and into this home. And it is wonderful because it is their home. They can walk into the kitchen, they can get things, and it's just been amazing, actually, with this population. So to summarize, there was an in their daily living skills that significantly correlated with tyrosine, but it was basically just the ratio. The cost of psychotropic medications decreased. The cost of living was reduced. The use of the large neutral amino acids was shown to improve their blood amino acid profile and increase the tyrosine and the tryptophan. It decreased the brain Phe levels because we did studies on that, and it was well accepted by our patients. In our clinic, we have about, I would say about 80% of our adults and adolescents that are on the large neutral amino acids. We have individuals that are in the honors program in high school, that are in good colleges, and that are doing very well. So it has been an option for those that have a very difficult time following the Phe-restricted diet. So I'd like to acknowledge the Frank D. Lanterman Center, who provided the funding for this study, and the California Department of Human Subjects, and thank you very much.